You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. Roland Martin Unfiltered. Right now, the White House is holding their daily news conference dealing with the coronavirus. Donald Trump is at the microphone. And as we tell you every day, we do not take him live because he lies far too much. We are not going to feed you fake information and lies. And so we will see what he says and then vet that after the fact. If any of the real experts, like Dr. Fauci or Dr. Birx, step to the microphone, then we will play that for you. Folks, as of today, there are 657,720 confirmed cases of coronavirus in the United States. 33,460 people have died from coronavirus. 53,322 are recovering. Now, that number dramatically increased in New York because of how they counted the folks who died. Now, New York State Governor Andrew Cuomo said that while there were 2,000 people diagnosed with the virus, the state also recorded the lowest amounts of deaths. He found hope in knowing that they can somewhat control the spread of the virus.
The number of new people who are diagnosed with COVID, about 2,000 still yesterday. So when you see the reduction in rates, remember what we're talking about. We're talking about a reduction in increases. You still have 2,000 people every day about who are walking into a hospital for the first time or who are being diagnosed with COVID for the first time. And 2,000 is still a lot of people. But the good news is it means we can control the virus, right? We can control the spread. And we did not know for sure that we could do that. We speculated that we could do it, but we didn't know. So now we know that we can control this disease. The bad news is 2,000 people walked into a hospital yesterday for the first time with the disease. And the worst news is 600 people died yesterday from the disease. That is still continuing at a really tragic rate. Of those deaths, 577 in hospitals, 29 in nursing homes. We've been watching the nursing homes because nursing homes in many ways are ground zero for this situation. Last night, the number in nursing homes was relatively low.
Now, folks, so many different things are happening when it comes to this coronavirus. How clueless is the Trump administration? Well, Donald Trump had a meeting today with the governors where he talked about giving them guidelines for reopening the country on May 1st. Then he creates this group, this working group of 36 members of Congress who are going to be on this committee. How do you create a committee of 36 people? Not a single black member of Congress on the committee. No, seriously, per Politico, the White House reached out to 36 members of Congress. There's not a single African American in the group. Who's most impacted by this coronavirus? Black people. Joining me now, Dr. Greg Carr. He's the chair of the Department of Afro-American Studies at Howard University. Reese Colbert, Black Women's Views, and Brooke Thomas. She's the host of Controlling Our Narrative podcast. Glad to have all three of you on. I will start with you, Reese. Just saying, 36 members of Congress, which represents a little less than 10% of all the members, and ain't nobody black, not even Republican Tim Scott.
Well, Tim Scott says that he's going to be on the council, but it's obvious that he is an afterthought if he is in fact going to be on the council. But Tim Scott is the same person that said that the $600 extra a week that's included for unemployment on the federal level is going to incentivize people to stop working. And so he was opposed to that. So even, I don't want to say all skin folk and kin folk, but if the shoe fits, hey, we need real representation. We need an actual seat at the table. Regardless of how people feel about the Trump administration, the people who are a part of this task force are going to have some sort of influence on the policies. We have the largest congressional Black caucus ever. So they had, Congresswoman Maxine Waters is the chair of House Financial Services Committee. She's laid out an extensive economic plan for how to reopen the economy. That's a person that you would think he'd want to tap into and use as an ally. You also have on the Senate side, you have Senator Cory Booker and Senator Kamala Harris, who has put out plan after plan, bill after bill that addresses a wide variety of things. So why not tap into those people? It seems to me that, with the disparate treatment that we're seeing and the outcomes we're seeing in Black communities, it's going to continue because our interests are not going to be represented at the table.
Greg.
Yeah, no, I agree with Reese. I mean, this is, I respect Donald Trump and his clavering. They are pulling out all the stops. They've dropped all pretenses. On a day when we can look, and Newsweek just reported that the governor of North Dakota is saying that, they're going to try to reopen May 1st. And in South Dakota, neighboring South Dakota, the Smithfield Pork Factory in Sioux Falls is now outpacing Cook County Jail in Illinois as the biggest coronavirus hotspot. What do we see? We see that, although in all fairness, the Smithfield Pork Factory in Sioux Falls, a lot of people who work there are immigrants, are non-white. But what we're basically seeing is white nationalism, as my friend and ancestor now, former colleague Ron Walters used to call it. They're circling the wagons. In a moment, when you see them trying to engage in voter suppression by doing everything from shortening the time that people can mail in votes to basically cratering the United States Postal Service, they realize they will never win another federal election. And so why keep up the pretense, whether it be the daily pep rally, press conference / campaign stops that Trump is doing from the White House, or whether it be this instance of putting together a committee with people who shouldn't be anywhere near it and then reaching out to Congress for your allies and ignoring everyone else. They're sending a clear message. The idea that this is a nation, always a fantasy, has now been dropped, and they are willing to sacrifice everybody. The only other thing I would say is that Donald Trump has realized, he doesn't realize this perhaps, and his supporters don't realize this, but everybody also means poor white people. Because as this disease, as this virus reaches those red states, in so-called flyover country, when you see death in those states, it won't be reported with the same type of ferocity and the same type of media attention that you're getting in New York or Los Angeles or Atlanta or New Orleans. And if when that death reaches that level of crisis in those states, I wonder how those voters who are wearing those red MAGA hats will respond to this man who is clearly using them as a human shield to advance his political interests.
But, Brooke, here's the whole piece. I don't think they care about that. Do y'all have that soundbite from Laura Ingraham last night on her show? If y'all have that soundbite, I want to play it right now. This is literally what she said last night in terms of, well, people don't mind getting coronavirus. I mean, it's crazy. Then you have Dr. Oz, who makes his comment. And so I play either one of those where he's like, well, we could reopen the schools and bring them back in as well. So let me know, play either one of those if y'all have it ready. All right, so let me just go ahead and pull it up myself, because this to me is crazy. All these people are pining, Brooke, for business to open back up, and I get it. I mean, look, we are impacted by what's happening economically, but this is Dr. Oz last night.
Dr. Oz, help us. Well, first, we need our mojo back. Let's start with things that are really critical to the nation, where we think we might be able to open without getting into a lot of trouble. I tell you, schools are a very appetizing opportunity. I just saw a nice piece in The Lancet arguing that the opening of schools may only cost us 2 to 3% in terms of total mortality. And, that's any life is a life lost. But to get every child back into a school where they're safely being educated, being fed, and making the most out of their lives with a theoretical risk in the backside, it might be a trade-off some folks would consider. We need to get industry back, supply lines. I mean, things that we can do without putting the nation at risk. Dr. Oz, help us.
You just heard him talk about this idea of 2 to 3%. Now, first of all, is he saying 2 to 3% of children? There are 57 million children who go to public schools. That's 1.2 to 1.6 million kids dying. Really, bro?
It's absurd. How do you say any life lost is a life lost? But how do you have a but to that? We're talking about lives. It's like, I think about it in a way of like the idea of choosing not to wear your seatbelt because only some people die when they go through the windshield. Even though we have a process in place, it's not the best right now. And no, it's not great for the economy, but we have a process, we have mitigation tactics in place right now that if people follow them, they will save lives. And that's all we have right now. We don't even have testing capabilities. What's been so frustrating to me about all of this, not even watching people who have such privileged lives talk about how it's not a big deal that people are going to die, that thousands and thousands of people, tens of thousands of people, hundreds of thousands of people, potentially millions of people could possibly die, that it's not a big deal because of the economy, blah, blah, blah. What's so frustrating is that this was a layup for Donald Trump. He could have simply taken any of the professional information that he was getting from doctors, from scientists, from experts months ago. He could have pushed these mitigation tactics into place, and now he would be sitting back saying, I told you so. Look at all of these other countries. I told you so. See, I am a good president. And everybody who hates everything about that comes out of his mouth would have had to been like, yeah, he's right about this one. And he didn't do that. And so now he's playing catch up, just trying to save face, and not at all. It doesn't seem to be worried about saving lives. And that's so frustrating. We are not at a place right now where we should be talking about forcing people, at-risk people, back to work, back to schools. We're not at that point right now. And it's so frustrating that everybody involved is not pointing out how ridiculous that is when anybody brings it up.
And what we're also dealing with now, what we're now dealing with are folks who are very good at lying, including his new press secretary, Kayleigh McEnany. Of course, you used to see her on CNN and this whole nonsense. She sent this tweet out here. As a result, the United States has now conducted more than 3.3 million tests, far more than any other country in the world. Okay, actually, if you look at per capita, South Korea has tested more. That's 3.3 million. Folks, that's literally 1% of America. Any scientist will tell you, any doctor will tell you, you cannot get enough data to understand the impact of this virus with only 1% of testing. And these folks are saying, let's just go back and again, back to group settings, putting people in environments at work. And you'll hear later in my interview with Dr. Regina Benjamin, they're still trying to figure this damn virus out.
Right.
This is, it's stunning to listen to these people as if, hey, it's going to be all good. Because here's the other thing. What now happens, Greg, if you get sick? What the hell? Who's paying those hospital costs?
Well, Roland, I think it's difficult for all of us because we've been raised in a society to think of the United States as a single entity. It's not true, not culturally, not socially. They're using what they have, which is the so-called bully pulpit, the propaganda element. So when you say accurately that 1% of the population of the country has been tested, we're thinking of the country as one place. But we've seen this week with the governors on the West Coast and the governors on the East Coast, they are in control. Someone has reminded or taught this fool in the last several days that he has no control. So he can put a talking head out there to say what you want. But at the same time, New York, Pennsylvania, California, Washington State will determine how best to approach the execution of what is a simple fact. People must be tested. Now, he doesn't control that. In Louisiana, there is a governor who will do that, regardless of whether this corn-pwned senator, who some claim had some kind of education at Oxford, John Kennedy, is running around saying, "Well, gotta open the economy." Okay, that's just talk. I guess what I'm saying finally, Roland, is that this type of campaign against public awareness will only be as effective as state and local leadership allows it to be, which means now, and you've been covering this, at the local level, when people go in the communities and say we have to be tested, we're going to have to meet them where people are, the garbage workers, the people working in the grocery stores. And when you come and say you must be tested, you've got to now also help them overcome suspicion of government from Tuskegee and Henrietta Lacks and others. And those are local conversations. Ain't nobody listening to that white girl.
It is. And not only that, so Reese, check this out. In New Jersey, they got an anonymous tip. The police in Andover, New Jersey, went to a nursing home, saw a body being stored in a shed outside one of the state's largest nursing homes. When the cops showed up, they discovered 17 additional bodies piled inside the nursing home's small morgue, intended to only hold no more than 4 people. 17 people they discovered. 68 deaths total linked to this long-term care facility. And then a number of people also sick. Here's the deal. Other people who died, including 2 nurses, also tested positive. Cause of death is unknown. Of the patients who remain at the homes, which is housed in 2 buildings, 76 have tested positive for the virus, including 41 staff members, including an administrator. Let's go to Florida, where Governor Ron DeSantis, he wants to give nursing homes immunity from being sued. It's stunning, Reese, what is happening here. They are treating like, oh, don't worry about it. Don't worry, we'll cover you from being sued. Don't worry about these deaths.
You know, it's absolutely stunning, the neglect, the cruelty, the apathy that this administration has towards people in nursing homes. Frankly, the Republican base is quite old. I don't mean that in a pejorative way.
Yeah.
They have an older demographic. What message are they sending their demographic? If for no other reason for electoral survivability, they want to get a lid on this. And the fact that they don't even give a shit about these folks should be a red fire alarm for everybody else. It's absolutely disgusting. It goes to the fact that we don't have a handle on the amount of carnage that is being caused by this virus. It also goes to the point that Republicans have said it's okay if people in nursing homes die. It's okay if we bring the kids back to school and they die. But I can tell you, every single person that I've seen in the news, once they have been personally impacted by it, they change their tune.
Right.
When you have the pastors, for instance, that said, I'm gonna, hold church or whatever else, or this is a hoax, and they die, their family says, take this shit seriously. And so it's not until it hits close to home for some of these folks that it's going to really, really drive home the point that this is a public global, with Donald Trump attacking the World Health Organization, with him attacking the blue states versus the red states. This is a global and national public health crisis where we have to be united. We have to actually address the problem. Donald Trump cannot bluster and bullshit his way out of this coronavirus pandemic. We need a competent and empathetic and long-term and immediate action on this. Testing, PPE, all of these things. And the fact that they keep lying about it is really scary, because that means that they're not taking action on it. And that's what we need right now. We need action, not bullet points and not bluster.
Here is Laura Ingraham last night talking about this. I'm trying to figure out, Brooke, why in the hell is she smiling? Watch this.
Okay. Life is filled with risks, in other words. We should all be careful and we should all be responsible, but the government cannot, nor it really should try to eliminate all risks associated with COVID-19 any more than it could with the H1N1 or the swine flu. When we step out of the door, when we walk onto the streets, we enter a building, we get into a car, get on a bike, there are always relative risks. But the damage to millions and millions of lives, including children's lives, and our basic freedoms during the shutdown, that's also very real. And for many, it has been absolutely devastating. Many are willing to take the risk of contracting the virus. We've seen that in the polling, frankly, what they rate as more worrisome to them. And they would risk this in order to preserve their way of life. Oh, okay. Life is filled with risks.
Okay, I'm trying to understand. Kill the audio, guys. So I'm trying to understand, Brooke. They're willing to risk that to preserve their way of life. Yeah, until they get sick. Until all of a sudden they begin to realize that, oh, I didn't even realize. So I might have it and I don't know it, and I might infect you, but then you have a pre-existing condition. Now all of a sudden you're worse off, and I can also spread it and have no idea. And that's really what the problem is. I mean, look, here's the whole deal. When somebody has the flu, we know they have the flu. When somebody has the flu, they are sniffling, coughing, wheezing. You can see throat, you can see it in their eyes, they're fatigued. There are people with coronavirus who are asymptomatic. You do not. I have never met, Brooke, somebody with the flu who said, I didn't know I had that damn thing.
Right.
I couldn't feel nothing. No, you know when you have the flu. And that's what the issue here. And I think, and I'm telling you right now, all these people can say whatever they want to say. I'm going to tell you right now, millions of Americans going to be like, y'all go ahead on out there. Go on. Y'all go ahead. Go on, kill yourself. I'm going to keep my ass right here while y'all go kill yourself. Brooke, go ahead.
Yeah, absolutely. And you know what else is different about this is that when people have a mild case of the flu, and I obviously think everyone should get flu shots. Everyone should do what they can to protect themselves from the flu during flu season, because the worst case scenario about the flu is death. And nobody wants that. That's the worst case scenario. But a mild case of the flu feels like a bad cold, right? A couple body aches, you're sniffling. That's a mild case of flu. I've had a bad flu, not the worst flu. But there are mild cases of this where people are talking about lying in their beds for 10 days feeling like they can't breathe. This is terrifying. This is not something that people should be taking lightly. And I would rather be poor than dead. I would rather be poor than my mother be dead. I would rather be poor than my sisters or my brother be dead. I can't. This is not a choice. This is a simple choice to me. Also, her argument that the government should not be protecting people from risk of a deadly virus, that is absurd. The government should absolutely be protecting the people that they're there to represent. This is simple. The government should not be bailing out big corporations that should be able to handle their bills and then just forcing people who can't pay their rent back into dangerous positions. And think about all of the essential workers right now who have never been paid enough. It is the responsibility of everyone who has the privilege to practice these mitigation tactics to protect them. So this is so frustrating for me. Like, she is spinning 30,000 deaths as some sort of a win.
And now they're also trying to spin this whole deal. Trump at this little news conference saying nationwide more than 850 counties, or nearly 30%, have reported no new cases in the last 7 days. I don't trust their numbers at all. But here's the flip side. Thing, though, 70% are. Go ahead, Greg. Go ahead, real quick.
I'm going to say very quickly, echoing what Brooke is saying. The state should be taking care of its citizens, but they're breaking it down by county because many of those counties got a handful of people in them in those red states. And as you said, you know who's listening to Laura Ingraham? Those people in Nebraska, North and South Dakota, in those rural areas, and they're going to get sick. Now, they can listen. While we're looking at why is she smiling? She's smiling because she knows anything she says they're going to listen to. And they're going to listen to her to their sickness and their death. Meanwhile, the rest of us, to your point, hey, stay yourself in place. It's going to be a very different country by the time we come out of this.
Man, I want you to like, share, and subscribe to our YouTube channel, youtube.com/Roland S. Martin. And don't forget to turn on your notifications.